Sometimes when people are doing stab and grabs, they're finding that they're not coming down right on top of their tunnel, where they're off to the side or something like that. And the problem is, if the top of your tunnel is here and you're coming in from the side with your hemostat, you have to pull that saphenous through all of that tissue to get it up and out. Obviously, if it's a skinny patient with not a lot of subcutaneous tissue, that doesn't create so many problems. But if it's a fairly deep stab, and I've had patients that this thing is, it's buried, and so I got to go with something deeper. I have to get a longer clamp and make a bigger incision and get down in there. So what you really want to do is make sure that you're coming down right on top. Most people will use their hands. They're holding the scope, they're looking kind of at their camera, and they're bouncing their finger over their tunnel, and hopefully you can see the tunnel collapsing right down on top, and that's where you make your little nick incision. Sometimes with bigger patients, though, when you push down, it just shakes the tunnel rather than show you exactly where you are. And so new harvesters especially, or everyone's dealt with it at some point, has pushed down and said, oh yeah, here we go. And they go to put their hemostat through the little nick incision, and they found out that they're coming in at this strange angle. And the deeper that is, the more you got to pull that through. So if you switch it out and instead of using your finger, you use your hemostat, that, because it's such a narrow surface area, when you push down, that can give you more of an idea of where you need to be. It's a little bit more precise when you push down on your tunnel. Now don't forget that you're going to have to pull that saphenous up and out to throw a tie around it. Now there are people that can use like an endo loop. Once all the branches are taken, they put the endo loop around and they use their scope to take it all the way up the tunnel, and that's totally fine. So disregard if you're not going to do a stab and grab. But if you are going to do a stab and grab, the deeper your tunnel is, the larger the leg is, the more surface area or distance you're going to have to pull that up and out, which means the more tissue you're going to have freed up on either side in order to make that happen, in order to get up and out of the leg itself. If you're a Mackay user, you will have already slid down, you've taken all the branches, so this saphenous is completely free towards our incision. So if it is a deep tunnel, you're going to want to reach in and reach towards your incision. Let's say my incision's down here. You're going to reach in and go towards your incision so that you can pull the lax part up and out rather than stressing the distal part that you can't get to with your scope. If you're a Terumo user and you're going to do your stab and grab before you've taken the branches, how much length do you have here? Do you have enough length that's you've got the laxity that you need, or do you need to take some of these branches first and then go back up and do your stab and grab? So if it's a skinny tunnel, I could go reach straight down and pull straight up. If it's a deeper tunnel, I need to pull this way away from my distal end and kind of pull this up and out like that. So that means I've got to divide all these branches first. So forgive my crude design skills here, but this is going to simulate a fairly shallow tunnel, in a skinnier patient. So if this is the amount of tissue we have to go up and through, then when I come down on my branch, on my saphenous here itself, and I pull it up, only a certain amount has to come up and out to be able to get a tie around that. Now that is compared to, let's say, a deeper tunnel. So now we have quite a bit of space. And of course, the saphenous is going to be somewhat elastic. The tissue is going to give more than this cup does. But if I now have to reach all the way down into this hole and pull this up and out, look how much force I have to put on that saphenous. So I need even more tissue on either side freed up to create the laxity to pull that up into the tunnel. And ideally, what I don't want to do is, let's say from here up is the distal end of my tunnel, I don't want to tear something up there because I don't have my harvester and my dissector only got to this point. If I tear something down the tunnel further, well, now I'm going to have quite a bit of bleeding to deal with, and I can't get there with my scope. So I want to free up as much of this as I can, meaning, all these branches should hopefully either be taken, or if you're a Terumo user and you haven't taken the branches yet, maybe slide down and take a couple of these to create a little bit of, freedom for that vein to kind of move a little bit. So if I have my conduit here and I've got a great big tunnel, when I pull it up, you know, if I have this, say this part freed up a little bit, what I'd want to do is I'd almost want to kind of pull down that way. So I would kind of angle it in this way and then pull this up and out like that, rather than, you know, just pulling straight up and risking maybe avulsing some of these branches over here. The more tissue you have to go through, the more freedom you need in that saphenous so that you can pull it up without creating stretch. Let's say this is our tether point, because we haven't taken this branch, and I go to pull, well, guess what happens? It's going to pull right on that branch itself. So I need to free that branch, that branch, that branch. Now I've got quite a bit of laxity I can pull up and out to be sure I'm not damaging the distal end of my saphenous, or anatomically the proximal end, but the part distal in my tunnel that I can't reach. And I've got plenty of laxity here that I can pull this up and out without stressing the other branches that are further downstream.